Hi, friends. Good evening. This is Dr. Chetna Jain, Director at Dr. Chetna's Clinic and Director at the Cloud9 Hospital, Sector 40. So, today we are going to talk on common discomforts in pregnancy. Now, pregnancy, though, is a very joyful and a happy time, but it leads to some discomforts in the body, which we talk from top to bottom or one by one. So, let's talk from above. So, first thing is headache. So, headache is a very, very common phenomena in pregnancy. A lot of women, because of the stress, because of the fear of unknown, or otherwise also because of the changing bodily hormones, might experience headache. So once, if somebody is experiencing headache, the best thing is to relax, take rest, try using the cold compress in the summertime and the warm compress in the winter times. Take steam inhalation. You can take ginger tea. And if all that doesn't alleviate your headache, then probably you can take some paracetamol. If in spite of that you have headache, you must consult a physician. Then comes dizziness. Now, dizziness is again a very, very common problem. Now, this can happen because you have not taken enough water and you're dehydrated, or could be because of the low blood sugars, or low blood pressure, or high blood pressure, or you're vomiting more, or you work very hard today and you're tired. So, any of these, if these are the problems, if your blood sugar is low, you can consume some fruits or something a little sweet, and your sugars will rise and you'll be fine. If you think your blood pressure is low, again, you can consume something salty. If you think your blood pressure is high, then you must take appropriate medication in consultation with the doctor. And if there is nothing else, you must relax and rest, and the things will fall into place. Then other problem could be you want to eat something like mud or sand or kacha rice. So all this is very common. Now, this happens typically if you have iron deficiency anemia or if you have worms in the stomach. So they should be dealt with accordingly in pregnancy. So if you, we call it pica. So if you have pica, please report it to a gynecologist so that this can be treated appropriately. Then comes nausea and vomiting. Now, nausea and vomiting are very common in early pregnancy. Typically, it starts by around 5 weeks of pregnancy, and in majority of the women, it settles by 13 weeks of pregnancy. If somebody is not nauseated in early pregnancy and there's nausea in a later pregnancy, then we need to evaluate these women for various things such as acidity, or gallstones, or pancreas problems, or gastroenteritis, appendicitis, and so on. So typically they are GI causes, gastrointestinal causes, and we need to investigate, examine them thoroughly, and identify what is the cause and treat it appropriately. Then nausea can be controlled by various things, like you can take ginger tea, ginger cookies, or there are certain medications like pyridoxine. So they will control the nausea to a great extent. So this is how you control. Similarly, for vomiting, if it is in the first trimester and there's no identifiable cause, then simple antiemetics can be taken and they can control the vomiting of pregnancy. If the vomiting is too bad and in spite of tablets and these vitamin B6 tablets, it is not getting under control, then possibly you will need injectables, either IV or intramuscular, to control it. Very rarely, women need to be kept fasting and they are given intravenous nutrition till the time they settle down. This is a very, very rare condition. Majority of the women will feel better with appropriate dietary modification and simple antiemetics, anti-vomiting medications. Then fever. Now, fever is not common in pregnancy. It may occur to non-pregnant also and pregnant also. Whenever there's fever in pregnancy, we need to investigate. We need to identify what are the causes. Like if somebody is having urine infection or throat infection or stomach infection, or there's infection in the uterus. So these are the common causes we need to identify, and then we need to treat it. Then comes breast tenderness. Now, breast tenderness or breast pain is very, very common in early pregnancy. As the woman gets pregnant, a lot of women will complain of difficulty whenever the undergarments they touch their breast or their clothing, or even by mistake when they touch themselves, they feel there's a lot of discomfort or pain, or otherwise also even without touching. Now, this is a very common phenomena. Not much can be done about it, but an adequately supported garment will support the breast adequately and it will reduce the pain in the breast. And you must also try to do some deep breathing in yoga meditation to alleviate such kind of discomfort in the body. Then the other problem which can occur in pregnancy is backache. Now, what happens is the spine is consisting of a lot of small bones which sit over one another like the blocks of wood. Now, because of the pregnancy, the curvature of the spine is further increased, and this is known as lordosis of pregnancy. So, what happens is a lot of weight in front to balance the body, to balance the center of the gravity. The upper body goes back, and the middle spine comes in, and that leads to a lot of stress on the spine. Now, what is most important is don't slouch. Whenever you sit, you must sit straight so your muscles are strengthened. If now the situation is really bad and you can't close it, then you can do one thing. You can wear a maternity belt. You can try with some cold compress or warm compress, some simple massages. If all these do not work, then you need to see a physiotherapist because there are certain things that they can use on your back to alleviate this pain. Cat and camel exercise is good for majority. However, most of the exercises should be done after or under consultation with a physiotherapist. So this is all about backache. Now, constipation. Constipation is a very, very common problem in pregnancy. With large levels of progesterone in the body, the intestinal movements go slow, and there's a lot of constipation. Now, this can be alleviated by walking, by drinking a lot of water, and if required, some stool softener can be taken. So there are various kinds of stool softener. One is isabgol, which is the traditional Indian method, and it works well. It also prevents intestinal cancer. So you can take it at bedtime with warm water, warm milk, or simple water. The other medication which is safe in pregnancy is lactulose, which can be used as 10 ml, 20 ml, or 30 ml bedtime, or maybe twice a day, depending on the need. And this can also soften the stool. Now, because of the constipation, a lot of women develop piles in pregnancy, and these piles can cause significant discomfort while passing stool. Now, piles need to be checked by the general surgeon, or you can at least speak to a gynecologist, and some simple remedies can be provided. You can sit in hot water tub, and there are some rectal medicines, inserts, and some tablets which can be given to alleviate the pain and to reduce the size of the fibroids, the hemorrhoids or the piles. Now, the problem with the piles is as during childbirth, when the baby comes out from the vagina, these are the swollen blood vessels which sit in the rectum or the anal canal, and with the passage of the baby's head, a lot of these come out. So they tend to regress post delivery rapidly. But if some of them remains after delivery, then possibly they will need surgical treatment to remove them completely, or there could be some cold skin tags which are not causing any kind of problem. Now, fissures in pregnancy are not common. However, if they are present because of the constipation, then they need to be treated with gels, and if required, some other things like manual dilatation, which is again a surgical procedure, but it is required very, very rarely. Now, leg pains are very, very common, but leg cramps are not that common. This is typically more common in women who are less physically active because of the poor circulation, or there could be certain deficiencies of vitamins. So some vitamin E or carnitine tablets, it improves the circulation in the legs, but leg massage, leg elevation, and inadequate weight gain and not excessive weight gain, and adequate exercises would help alleviate this kind of pain. Then comes tingling and numbness in the hands. Now, tingling and numbness in the hands is also because of the weight gain. So there's nerve compression, and this nerve compression leads to a lot of the tingling and numbness. So all those who are deficient in vitamin B12 should take vitamin B12. The rest should exercise and try not to retain water. Some reduction in the salt in the diet can improve the numbness remarkably, and also some kind of exercise like where you raise your hands and do some ball exercises against the gravity, and the blood flow will go down, and you will find that the swelling in the hands is reduced and the numbness also reduces along with that. So these are the common problems in pregnancy which are very commonly seen, and in case you face any of these, then possibly you can just consult your doctor. The other one more problem which can be seen is increased vaginal discharge or a lot of vaginal infection. Now, what happens is during pregnancy, because of the increased levels of glycogen in the vaginal mucosa, a lot of yeast infection comes in, and this can be again treated by giving some local pessaries. Mind it, during pregnancy, oral antifungals can't be taken, can't be given. So all this needs to be avoided. So overall, pregnancy is a very joyful condition. But yes, you need to be more disciplined. You have to maintain your body, exercise regularly, eat healthy, and any kind of discomfort, you point it out to your doctor, and they are going to give you a remedy so that you are alleviated of that discomfort and you can lead a very happy and normal life during pregnancy till the time the child comes. And then again, you need to speak to the child specialist and your doctor then how to manage your time, how to compartmentalize your life so that you give adequate time to the baby and to yourself also. So enjoy your time, have a happy day, happy life, and enjoy your pregnancy. If you have any questions, do write to me. My WhatsApp number is 9910907222. You can also write to me at janchetna@gmail.com. I'm available at Cloud9 Hospital and at Dr. Chetna Clinic in Palam, Bihar. Thank you. Have a good day.